Hi, everyone. Welcome to episode 33 of the Future of Work show. Now, if you've been with us for a while, you know that this is not the kind of topic we usually talk about. Uncube is an education and advisory firm focused on the future of work. However, we're living in extremely challenging times, and there are concerns and questions which are uppermost in all our minds. In fact, in my own family, we've had a couple of experiences of COVID, some very, very recently, and have sort of firsthand encountered the challenges of caregiving for a COVID positive person. So, with that, I have two very, very special guests with me today, and I'm just going to bring them on and introduce them to you. My first guest is Bhavna Isar. Bhavna Isar is a postgraduate from XLRI. She's held several senior HR roles before starting Caregiver Sathi in 2014, an organization actually dedicated towards supporting caregiving, which is sometimes quite overlooked as an area of expertise. So I'm so delighted, Bhavna, that you can join us. Thank you so much. And my next guest is Professor Sujata Sharma. Now, Professor Sujata Sharma is one of the rare women, I think, in our cohort to have a whole Wikipedia page about all her amazing accomplishments. She is a professor of biophysics at the All India Institute of Medical Sciences. Her research has been published in over 150 scientific journals. And she's also the author of 3 books, quite a prolific writer. I think every second or third year, she's been coming up with a book over the last 4 years. And her last book, in fact, was on the COVID experience of doctors, and it's called Warriors in White. And I think Bhavna has just dropped off. I'm hoping that she'll be able to join us really, really quickly. So with that, let's start off the conversation for today. Thank you so much, Professor Sujata Sharma, for joining us.
Thank you. Thank you, Dr. Nag.
So one of the first things I'm going to ask Sujata, if I may, is that, one of the biggest concerns of a caregiver, particularly for a COVID patient, is, how do I stay safe myself? And, there are some COVID patients who are home isolating, and then there are others who are in hospital. So I'd love to hear your perspective on what is it that a COVID caregiver very specifically needs to do so that, they are personally safe through the process of caregiving.
Shalini, I think if the person in question is in the hospital, then of course the role of the caregiver is minimal because you're not allowed inside the ward. But if the case is a mild case, then of course you have to undergo the home isolation and you have to depend upon the caregivers in your home. So, if you actually see, there could be 2, 3 scenarios. The first scenario is that the person who's got COVID is absolutely healthy, since he may be just having a mild disease, but he still has to isolate himself, wear the mask all the time, and isolate himself or herself in a room where he can have his or her own bathroom facilities. So that was one scenario. The other scenario is that you are uh, in a room, but the bathroom is common. And the last scenario is that you can't isolate that person in a room. You have to share the room. So I would like to just go about all the 3 scenarios. So supposing he or she has his own room with his bathroom, then all you have to do is that you have to just provide food and with, fresh clothes and things like that, and make sure that when you are handling his or her used clothes or maybe plates or knives or fork, then you have to constantly wear gloves and you have to wear a mask all the time in your house also, because now recently a new advisory has come that you have to wear a mask inside your house because you never know who's COVID positive. So if you have somebody who's COVID positive, then yes, you have to all the time wear a mask. And of course, if by some chance you are sharing a bathroom with a COVID positive patient, then you have to have an interval of something like half an hour before you enter the bathroom. And you have to keep the exhaust on, make sure it's properly ventilated. The last scenario is that if you are all sharing one room, then you have to make sure that the person is at least 6 feet away all the time and constantly wearing a mask. So this is how you have to protect yourself.
Yeah, that's. I mean, as you said, it's pretty tricky, right? It's really
Yeah, it is
tricky.
extremely tricky because the biggest challenge is that you want to be with the person you love, and
Yeah.
especially when he or she is ill. And of course, like I said, there is one more situation in which the COVID positive person is a child or is too ill, especially when they get high fever, is too ill to do anything on its own. Then, of course, you have to be with that person all the time. Then, of course, you have to take care, wear a mask all the time, keep yourself as much as possible. You have to keep yourself isolated from that person.
You know, Sujata, we had a case in our home where a very elderly person was down with COVID, and
Right.
he was in home isolation, except that he
Hmm.
had a fall. And in
Hmm.
that case, you need to, for a caregiver, it's a very
Right.
difficult place to be, because obviously you want to rush in and be of
Right.
help. And it's not very clear for most of
Yeah.
us that what is the right action, what is it that you're
Right.
supposed to do. I think when people are relatively mild and not terribly
Hmm.
it's a little easy. Like when my son had COVID, he was in
Right.
isolation for 14 days, and
Hmm.
we spoke across
Hmm.
the door. We never saw him, but
Right.
he's a young guy, so we sort of knew he was fine. But with elderly
Hmm.
patients who can get very weak very quickly, I think that's. I
That's
don't know
very tricky.
if you have any. I don't know if there is a good answer to a question like that. That what do you do if
Right.
the patient himself or herself needs care at a particular point in time, and you may not have PPE gear, etc.
Right.
And most of us don't have that in our homes, right?
I think wearing a mask and a face shield is good enough, especially if the mask is N95 and you can have a cloth mask all over it also. And of course, a three-layer mask is good enough for the patient and for you both. And if
Okay,
the caregiver can wear a face shield, then I think it's good enough. But of
okay,
course,
okay.
one has to keep one's emotions away from the situation and handle this in a very practical and clinical manner.
In fact, in one of the cases, we had a family member who was in the hospital, but in a
Mhm.
hospital where patient visits were allowed.
Okay.
So my husband, who was the primary caregiver, had 2 visits a day, for instance. How does one stay safe as a caregiver in, such circumstances?
I like I said, you have to wear gloves all the time. You have to wear a mask, your face shield all the time. As much as possible, stay 6 feet away. But of course, if you are taking care of the person, you cannot stay away. So in that case, I think mask and face shield and gloves are good enough,
Okay.
provided that you discard them constantly.
That's a very, very helpful suggestion. It's a very practical suggestion, because I think PPE, one, not everybody has it. Second, it takes
No,
time to get
right,
into,
right.
right?
Yeah.
And on the other hand, something like 2 masks, and as you said, an
Hmm.
N95 mask along with the cloth mask, so
Okay.
two layered masks,
And if
gloves, and a
possible,
face
face
shield.
shield. Right,
So
right.
4 things, 4 items
Yeah.
can keep you safe for the most part.
Yes.
That's really, really helpful. Bhavna, welcome back.
My apologies.
No, we all have these challenges over, net connectivity all the time. So, Bhavna, I know that you focus on really the work of a caregiver. And in our conversation, you had some wonderful ideas about, how does a caregiver even begin to think of their role? And in fact, I know that you spoke about many different roles within, the caregiver. I think the words you used were constellation. So I would love to hear from you a little bit about, how do you see the caregiving roles, and how do they fit in with each other?
Thank you. So I think the first challenge for especially most of us who live in the kind of culture like India is to accept that we are caregivers. Um, Most of us see ourselves as in our family roles, right? So we are a good son, daughter, wife. We don't see ourselves as caregivers. So the first thing is to recognize that I'm a caregiver, whether I'm offering physical, emotional, financial, whatever kind of care that I'm offering, I am a caregiver. And one of my favorite quotes is from Rosalind Carter, who said, "There are only four kinds of people in this world: those who have been caregivers, those who are, those who will be, and those who will need caregivers." That said, uh, given the current health crisis, um, care is a very important part of healing and health. And when that happens, a large number of people have different roles to play. So, like I said, there is physical care that has to be provided. Professor Sujata nicely pointed out how you could look after yourself physically as a caregiver. And there is the whole mental and emotional aspect of being the caregiver, and the anxiety and the fear and the sense of responsibility and duty that can impact you as well. So I think taking a step back and looking at what I call the constellation of care is to recognize, where are you in that relationship? The primary caregiver is usually the dyad, or the person who is directly in touch with the patient. So that's the dyad. And you could be a primary caregiver, or you could be a secondary caregiver, or you could be a well-wisher of a caregiver. So recognizing where you are in that constellation, I think, is the first step. To then be able to say, okay, what's my best role here? Yeah. So if I am the secondary caregiver, or if I am the well-wisher of the caregiver, then I have other things that I can support with. And I do think that in these times where everybody has the best intention to be helpful and to be able to reach out, sometimes we do it, we overdo it, and we pressure the primary caregiver for information without really wanting to do it like that. So I do
Could you,
think
Bhavna, just explain the role of the secondary caregiver and well-wisher? I know because of our conversation, but I realized we didn't actually cover it in the last couple of minutes. So if you could just clarify what's the role of a secondary caregiver? What are they? Who is a secondary caregiver?
To me, the primary caregiver is the one who is in close contact and is responsible for that patient's well-being on a daily basis. That's a primary caregiver. A secondary caregiver could be somebody who's long distance, for example. So many of us live in distributed families or nuclear families or our friends, etc. And currently with COVID, even if you are close by, you're not really close to the person, right? So anybody who is at a distance and therefore providing support from a distance, but is invested, to my mind, would be a secondary caregiver. And recognizing that I'm playing this role, but I am the one who's going to provide the care, will be secondary. The other is that I'm a friend or family of the caregiver, and therefore I'm the well-wisher, allows you to define the scope of how you're going to interact with that person. So if I'm the well-wisher of the caregiver, allows me to say, okay, maybe my best use of myself and my role here will be to get authenticated information for the primary caregiver, because the primary caregiver is under stress. So let me reduce their stress by saying, okay, you need this, let me go figure it out and come back to you. For example.
Right. Yeah. Great example.
And keeping your, therefore, keeping your calm or your ability to recognize that you are getting impacted by the trauma as well is equally important.
No, what you're saying is so true, Bhavna. Most caregivers are so caught up in the role that I think even this realization that it's a role which will need care of its own, it's not what comes to mind for the most part. And honestly, I love what you said. So I'm just paraphrasing it, that the primary caregiver is the person who's got, in the end, sort of the final, the one in frequent contact, perhaps the one who's taking the decisions on a day-to-day basis of what needs to happen, etc., etc. So that's the person who's most intensely involved in the process of caregiving. And a secondary caregiver could be somebody who's supporting the primary caregiver. And that support could perhaps come, like you said, in providing particularly these days, authenticated information, since just getting authenticated information is just so difficult. Or it could be in providing structure, resources, whatever else is helpful for the primary caregiver. And a well-wisher is people who are they want the very, very best, but aren't necessarily in a position at that moment to provide more active support. So if I understand correctly, that's the kind of differentiation that you're sharing.
Yes, there are three kinds of well-wishers. One is friends, the second is family, extended family, and the third is workplace colleagues, who are well-wishers in different ways. And recognizing what your relationship is and therefore what kind of a well-wisher you are helps you define the role that you can play and the kind of support that you can offer to both the primary caregiver and the patient and the rest of the system. So I think, well-wishers have a very big role to play. Caregivers, like you said, are in the thick of the emotion and unlikely to be able to take a distant view. They are also emotionally invested. So they are caught with fear, pain, helplessness, sorrow, and guilt and anxiety. And while all of that is on there, it's very hard to discern which one is catching me at this time. To be able to then be, able to access what is the right thing to do at this time. One of the top 5 dilemmas of caregivers for terminal illnesses otherwise is having access to that information that I need for quick decision making. Very often, caregivers don't have access to that information. Notice today as well, a large number of people in their well-intention are likely to forward 10 lists saying, oh, I found this, find the oxygen concentrator here. But what is really happening is that you get 10 numbers, which might be verified or unverified, and is only adding to the stress of the caregiver. So the well-wisher could play a better role by saying, okay, let me sort this out and come back to you with 2 numbers that are verified, and that will be better support than just random forward. I got this from another group, let me send this here. I mean, that is creating a lot of waste in our system.
That's a really good point, Bhavna, and particularly today, because there is such a scarcity of verified, credible information, and frankly, that's part of the reason why we're having this conversation. That most of us don't know where to go to, where the right answers are, and there are WhatsApp forwards. I think every 10 minutes, with this list, that list, and people who've gone through that experience of calling numbers will share that most of them are duds. So that's a huge amount of, energy, time, and frustration. So
That's right.
I like what you're saying, that, the moment you identify whether you're a primary caregiver, a secondary caregiver, or a well-wisher, it helps you define what's the role that you're going to play in this entire process. And perhaps what you're saying is that part of the role is in supporting the primary caregiver himself or herself in what they're doing and thinking about how can you make their job easier so that they're able to do what they need to do best.
Yeah, I do
That's
think that
really,
there are
really
a couple of areas where people are volunteering as well. So instead of indiscriminately forwarding unverified information on WhatsApp, it might actually be a better utilization of your time to sign up to one of these volunteer programs and channel your energy in a specific way, for example.
Very helpful, Bhavna. So, Sujata, I'll ask you a question which is top of the mind for particularly a COVID caregiver. We know that the reality is our medical professionals are so overstretched at this point in time. And I don't know whether this is correct or not, but a few days back, someone said that there are 200 patients per doctor at this point in time. So whatever is the actual number. So one of the realities is, and one frankly that we personally experience, that because doctors are so overstretched, it's hard for a caregiver even to get access to them. And, even getting any, medical opinion is very, very hard. So for instance, in our case, just meeting the doctor meant waiting for 3 or 4 hours every day. And the meeting might be like 2 minutes and some days not at all. So, there is this whole challenge, which is true today and may not be true in, regular times, where even getting feedback or, what's the next step, what's your perspective is extremely hard. So caregivers feel this, much, much more heightened responsibility that, we have to watch out for our loved ones, because the medical staff is overstretched. They do not have the capacity to focus on him. He's the only he or she is the only person we're focused on. They're focused on, say, whatever, 100, 200 people. So when would you know as a caregiver that something, you have to raise the alarm, something has gone wrong and which might be missed? And if you could share this both from the perspective of when, the patient is in a hospital and when you are responsible as a caregiver at home.
So, Shalini, it's like this, that COVID is basically a mild disease for most people. In at least 85 to 90% of the cases, it is self-limiting and it gets resolved on its own. If you have some basic medicines like paracetamol, and you don't need to self-medicate that much. So you just need hospitalization in the case of 10 to 15% of cases. And those are the cases which could be severe. And it's only in case of 5% that you actually need to go to a ventilator. So I feel that one has to be totally, one should not immediately raise an alarm the moment you get your test report and it says positive. What is mostly happening is that people are getting very, very stressed out the moment they see COVID positive. They feel this is it, this is the end. Actually, if you see, most cases are just getting sorted out themselves. So what you have to do is that you have to provide the COVID positive patient with a thermometer and with a basic oximeter, with which he can just keep on analyzing what his oxygen saturation is all about. He has to just keep a watch on his temperature and oxygen saturation, and that is all. Nothing else. There is no point of worrying too much about the lab values, getting tests done. It's not required. If your oxygen saturation is above 93, 94, it is not required. That means your body is coping well, it is fighting well, you're going to be fine in 7 days on your own. So all what I did actually when one of my relatives was down was that she was, of course, self-isolating. She was living in her own house, and we just made a WhatsApp group, and we just asked her to simply keep on telling us her oxygen saturation, measuring it herself, which is very simple, and just telling it to us after every 2 or 3 hours. That's all you have to look out. So it's only when your oxygen saturation is falling below 93 or so, or you're feeling breathless, or there's some heaviness in the chest, that is a time when you have to worry. And of course, you have to have a family physician who's accessible to you. There are a lot of physicians who are coming out, especially nowadays, and they're making themselves accessible. Even in government hospitals now, we are having programs in which they are available for a certain amount of time every day. And you can sign up to these hospitals, you can call them, the call lines are open, and you can, this is of course a very recent kind of I think only last week it has started, but it is there, and people should not panic. They should find out which are those physicians which are ready to talk to them, help them out, even on social media. I've seen on Facebook and on Twitter, people are available. So as Bhavna said, there are well-wishers and secondary caregivers who can actually maybe go and look for these kind of people who are ready. Even if your family physician is overstressed, you can find other physicians who are ready to help you out with this. So it's only when your oxygen saturation falls below 93 that you have to actually consult with a doctor as to what to do. And you have to think about the hospitalization, not before that. So there is no point of,
Sorry, please go ahead.
So there is no point of rushing for beds and looking for oxygen. If by chance you do not have oxygen resources in the hospital, you can keep some oxygen concentrators inside your home and use them as a temporary basis till you get the bed.
Right,
And that
right.
is also if it's below 93, not before that.
I like what you said, Sujata, about the fact that first, if it's home isolation, all you need to do is monitor
Hmm.
temperature and oxygen saturation levels. And as you said, for the most part, most patients will be fine just with that. 85%, I think you said, or I've heard, will be fine just with that. There is the possibility, however, that in the other 15%, there is a greater, need for support. And when I spoke about the fact that it's really hard to have access to doctors, you've also mentioned that recently there are doctors who've opened out. If you have any names, I mean, do share, or if not, at least you've shared with us that they are available specifically with the with the understanding that this is an emergency. And there are many people who are really challenged to even get advice. I do know that there are some support from some of the medical hospitals which have started. I believe Max has started one where there are virtual consultations possible. So all of that might play a role in providing guidance. So I think that's really, really helpful. I also like what you said, that the next step, if oxygen does fall, is having an oxygen concentrator, because most people aren't clear what is the next step. Frankly, nobody is clear. Should you be getting an oxygen cylinder? Should you be doing an oxygen concentrator? Like, what are you supposed to do? And
Right.
so one of the challenges, Sujata, these days is that now, I've heard that even getting an oxygen concentrator, for instance, is today a very difficult task. I've heard it's going on the black market for ridiculous amounts of money. I know this is perhaps an unfair question, but what does one do if one can't get access to resources? Is there anything that, are there things we don't know about?
Actually, that this is very unfortunate. That the moment we have a crisis, then we have hoardings of things. That is what is extremely unfortunate, and that is what has probably led to this kind of a crisis. And of course, we have come to this point that we are depending a lot on the community help that we are having amongst each other. So I'm really hoping this crisis resolves soon. But right now, if it's possible, if you can get an oxygen cylinder or an oxygen concentrator, and that too for temporary basis till you get a bed. And of course, keep away from false information. Do not fuel the black market by buying things at a very, very high rate. But I know that these are desperate times, and you really cannot blame anybody. But what is sad is when people who are having oxygen saturation, say 98, 97, are holding oxygen inside their house. It is not required. Or they are using uh, some contacts to get a bed when it is not required for them. Maybe a more serious patient needs that bed. So this mentality of me first, and I what if something happens tomorrow? So let me hold this. We have to actually, as a community, get over this mentality. Each person has to do it. That's the only way we can resolve this.
Well said. Although I completely recognize also the panic when it's your loved one and you do not have access, and the reason why people are willing to pay ridiculous sums. Not all of them have that money, but they're willing to
Yeah.
pay it because they feel, okay, maybe that will help, maybe that will save. When we don't have access to what's called an oxygen bed these days, I hadn't even heard that term earlier, or a ventilator bed. So that's one of the realities. I know, Bhavna, you were trying to say something. Please go ahead.
So I think it's important to recognize how, as a well-wisher or a caregiver, what is, again, how is the anxiety getting the better of you, for example. I love the points that Professor Sujata made about taking stock of the situation and saying, do you really need hospital or healthcare services at this point in time? And allow for those who really have the critical need to access the emergency services, given especially that they are in such small availability. There is a decision point. There are some resources, for example, on our group where we have shared when and how to buy concentrators. Well-wishers of caregivers can play a very important role in educating themselves and the primary caregiver. Please see in this, the primary caregiver is likely to be in the grip of fear and panic more than the well-wisher. The well-wisher needs to figure out what's the right thing to do, hold the hand of the primary caregiver and say, listen, you need to do 1, 2, and 3. Do these 3 things, and I will talk to you after 1 hour. Then we will do what needs to be done next. You don't need a healthcare practitioner or a mental health professional to be a companion and a friend to a caregiver. As a well-wisher, you break down the entire information. Do not forward long emails, messages, videos to a caregiver saying, do this. For example, talk to the caregiver and say, I read about proning. Proning means 1, 2, 3 things. Do you know what proning is? Okay. If you don't, you have to do A, B, C. Do it, and then I will come back to you with the rest. A well-wisher can play a very significant role in this. And that's the big point that I wanted to make. So processing information, breaking it down, and making it available to somebody who is in the thick of things, caught with the rest of emotions, is very, very important. That's how we create a network around the patient and the caregiver, a supportive network that takes away the panic and anxiety. The important thing, the other thing that I wanted to talk about, the second point, was that we need to discern between the difference between cure and healing.
Yeah.
It isn't a cure, it's a virus. There has to be a healing. Healing requires conducive environment for the person to tap into the resources of that person's body to heal. That requires being mentally at peace or believing that they are getting the right support. The support the caregiver gets and the support the patient gets, the environment in which they get that creates the conducive environment which is essential for whatever curative actions you're taking. So well-wishers and secondary caregivers and everybody else who is well-meaning need to create an environment that is more healing.
Right,
That's what I
right.
want.
I love that, Bhavna. I love that because I think it just says that, listen, and frankly, the reality, and even frankly, I have done it, that if there is a primary caregiver, that person takes on all the load, sort of processing the information. Obviously, the entire decision making is theirs, the physical labor, the, emotional, and everybody else basically just says, okay, so what's happening? Keep us updated, which doesn't help because it doesn't add anything to the role of the caregiver. And I love the fact that you've pointed out that the caregiver and the patient are almost like a dyad, and the rest of the system, the secondary caregiver, the well-wishers, need to then think of themselves as, okay, how do we create the support structure so that the primary caregiver is able to provide the kind of support that the patient needs. That's a very different way of looking at it from how we generally do.
I'd like to mention here, sometimes well-wishers need to actually be very specific in their ask. When they call in to ask for the patient and their well-being, and they ask, so how is so-and-so, please remember to ask, how are you? Because while the caregiver is looking after, it is worthwhile to check in on them. They might not answer, they might not say, I'm okay, mujhe kya hua hai, etc. But it's worthwhile asking them or checking in them how they are and giving them some space for that. The second, right, when you call in, say, how can I support you? Or ask, what is the most important thing that you need to do today? And how can I do it for you? So be specific about how you can help. Don't say, अच्छा कोई काम होगा तो मुझे बताना. Or, tell me if you have something to do. The caregiver is unlikely to be able to define a job or a task for you.
No, I think that's a very specific, good practical tip that instead of saying like we all do all the time, right? Acha koi kaam ho to batana, which is like a general well-meaning thing that we are there for you. But of course, then what you're saying is that the emotional whatever load or the mental load of deciding who should do what lands on the primary caregiver, and they don't have the mental space for doing any of that. They'll probably rather say, let me do it myself. So to word the question as what's the next thing that you are working on, and then see if you can provide some support or help there, I think that's a very practical and a very actionable point. I'm just going to take a look at some of the questions. Ria, hi. My son had it 3 weeks ago. I had to prepare myself with steam, pranayam, vitamin C, and sunlight, even more in frequency myself. I think that sounds like a very good routine. Papia, hi. We are all caregivers in some form or the other. By recognizing this role allows us to plan an interaction with clear objectives of service. I absolutely agree. I think, in fact, Bhavna, that's one of the things I really liked about your, this idea of constellation, idea of different roles amongst caregivers, because I think it's really, really helpful to see where, I think in your words, where do you fall into within this constellation? I think that is very, very helpful. Sanjay Thakur, thanks for the relevant session. As per latest Lancet report, when virus is airborne, then wondering as to how to protect, as virus doesn't necessarily enter through nose, mouth, but ear, eyes too. Have attended a few friends over last few weeks and thankfully am safe so far, but after reading the Lancet report, I'm worried. Other than mask and gloves, we are not looking at anything else while caregiving and do not think about so many ways one can get infected. But lately, I can see people trying to maintain distance. Sujata, do you have a perspective on this?
Yes, as you pointed out, eye also has a membrane on which you have receptors, the receptors for the virus, and that is one area which is totally neglected. Nobody talks about this, and it's a very, very relevant point because the virus enters through ACE2 receptors which are present in nostrils, mouth, and eyes. So the best way to protect yourself is using a face shield if you are in touch with a COVID positive patient. A face shield is going to protect you. In fact, this is a personal thing, but I like to wear my sunglasses even when I don't need them, just because I'm fearing that I have to protect my eyes also. Because nowadays with the second wave, a lot of people are reporting conjunctivitis or pink eye, and right after 2-3 days of that, they become COVID positive. And this is a very ignored and a neglected area that people are just not talking about the eye. So I'm glad you brought this up. Yes.
I think that's a very, very helpful, both the fact that something as simple as glasses or a face shield, it's not something one has typically heard of. The mask, of course, has been, the only thing with safety sort of equipment that's been most
Right.
central to this whole conversation. The double masking is a recent one. The having cloth over N95 is a recent one. The gloves, I think, are also relatively recent, and perhaps more for those who have entered a hospital setting. So I think
Right.
it's very helpful for us to know that eyes are also a possible area. Bhavna, you wanted to say something?
I have a little view on that, which is that yes, we can take all the precautions that we can take. Yeah. And we will be surprised by things that will unfold that we had not known so far. The practice of resilience is to be able to take an unanticipated thing that is hurled at you and be able to respond to it. So there will be many other things that will come our way. And there is no point in getting caught with what if that, action B, C, D. I think it is worthwhile to take lessons from my favorite hobby, which is motorcycle riding. So when you go long distances, especially hills, the thing that you have to focus on is focus on 400 meters ahead of you that you can see. Do not think about the peak. Think about what you're riding on. We don't know what all will be thrown at us, which curved balls will come our way. And investing in that is likely to reduce our immunity because it is going to trigger fear and anxiety. So we will cross the bridge when we come to it. In the meanwhile, one step ahead, one day at a time, and focus on that which is in your circle of control and do the best that you can.
Yeah, I think
That's
both of
my
you,
view.
both of you have very connected, points. So one is about, like, you wear a helmet, right, when you're biking. So what is it that you do that is going to help you stay safe? And if you know that there are these 4 items that are going to help you, then obviously it makes sense to have those 4 items if you're in the role of a caregiver. And then, I mean, I certainly see your point that even so even so there will be surprises, and even so you don't know what's going to happen 3 days from now. You only perhaps can think of the day, one day at a time. And as you said, actually, the experience of looking after a COVID patient is particularly scary because things can turn bad very, very quickly. And a lot of people who are caregivers, or particularly primary caregivers, are almost on edge all the time because they're worried that, what if I miss something? What if I miss something? And that's the really critical thing. I should have alerted somebody to. And and you hear horror stories, obviously. I mean, it's a reality, right? It's a reality. There are people suffering, there are people dying around us all the time. So then let me ask you, Bhavna, what would you recommend for the primary caregiver, so that the primary caregiver is best placed to look after themselves physically, emotionally, mentally? What is it that they should be doing?
Okay, so I think that primary caregivers need to first step back and build their physical and emotional infrastructure. I think recognizing what is it that you need in terms of resources, physical information, and what do you need to replenish yourself emotionally has to be understood. There are usually one or two people in our lives that we can really be ourselves and who can give us the space of non-judgmental, expression of anger, frustration, disappointment, our dark side, so to speak. So we need to have that emotional infrastructure, somebody that I will call in and say, listen, I feel like screaming just now, or I'm tired, because this is going to be tiring and this is going to be difficult despite your best intention. So building your physical and emotional infrastructure is absolutely essential. Well-wishers can help primary caregivers do that because it's sometimes hard. The other thing is to think about different ways of communicating. So, for example, we have a certain style of communicating. Like you spoke about the elderly person falling down and you being afraid of wanting to help or not help. Um, we have a situation, someone I know who is elderly may potentially not be able to see. Now, how are you going to get the oximeter reading, right? So to be able to talk to someone else and say, this is my problem, can you give me another way I can solve it? So seeking help is absolutely essential. And then there are 3 or 4 practices of self-care, which include defining your boundaries and the scope of what you're doing, and being able to look at one day at a time. So, for example, if defining the scope of your boundary of how you are interacting with means that you politely decline a few things, you say, I'm not able to take this call, or I do not want to answer this. These are good practices of maintaining your well-being and self-care because you are involved in caregiving. The next is having some practice which allows some ritual of starting your day and some ritual of ending your day. Because we are taking one day at a time, it is one unit. Start the day with whatever your ritual is, whatever your practice is. Do something for yourself and close the day. Make sure you have spoken with someone who has given you an expression of care so that your cup is full. You can't pour from an empty cup, right?
Very well said, Bhavna. I think it's, I mean, I've hardly ever met a caregiver who's thought of it like that, that, okay, what is it that I need? Because I know that when you're particularly a primary caregiver, you're like not even thinking of yourself at the time. You're like, okay, what does she need or he need? And it's an all consuming one, particularly with COVID, because, things do get critical sometimes for for some people, and they get critical very fast. And it's like, I think primary caregivers are almost on edge all the time, because if they are, if they're tending to someone who's like sort of borderline, who's maybe a 90 oxygen concentration, 88 oxygen concentration, which is not worrisome per se, but it's not great either. And so, you're just sort of like, okay, is this something I like what you said. I think it's going to be really hard to practice for COVID in particular, just because people are, as caregivers, just always on. It's so hard to put an off button because of the nature of this. But I think the idea of having an emotional infrastructure, or even thinking about an emotional infrastructure, who's the person you can call, who's the person you can sort of be yourself most with and share your frustrations, because obviously it's not always going to be an easy process. And in today's time, being a COVID caregiver is particularly hard, because, all your familiar processes of, okay, I will reach out to Dr. X, hospital Y, you don't know whether they will be accessible to you at the moment when you need it. In fact, in Delhi, as of course we know, things are terribly difficult.
I want to bring in a word for the healthcare workers. Sujata has been very kind, but we have to offer compassion and space to all our doctors and healthcare workers. I'm in touch with a few incredible people who are handling calls 24/7, supporting families long distance, an expert doctor also organizing ayas for the elderly long distance. I mean, that's unfair. Sometimes as primary caregivers, we burden the doctors and the healthcare practitioners way too much. And I think it is time that we think about them and the fact that they are dealing with really heavy stuff. And how is it that we can reduce the burden on them? So they are grappling with helplessness and grief of a very significant kind.
There's no doubt. What you're saying is absolutely true. There's no doubt. It's a really, really hard one. And of course, Sujata is in the thick of things along with her husband, who's also a doctor at AIIMS and attending to many people in challenging situations. So I'm just going to take a few more questions. There's a question for us secondary caregivers who are not in India, but are trying to care for loved ones in India. It's hard not being there in person. So agree. And trying to be useful in some way other than words of encouragement. I think completely see your point. I like Bhavna's idea of, for secondary caregivers or well-wishers, this role of verifying information in today's environment, just because getting verified information is so hard. And if time zone isn't a terrible challenge, then maybe that's a very important role that one can play today. Gurleen asks, which is making people more anxious, the virus or the hysteria in the media? How to not be obsessed with watching news and glued on the phone for COVID news? Would either of you want to take that on?
I think
sorry, should I go ahead? Yeah.
Yeah, you
I
go
think
ahead.
Sujata started. Let Sujata go first. She just started.
Yeah.
Actually, I'll just tell you that this is something which we call infodemic. It's a pandemic of information, and mostly it's unverified. It is illogical. Like if the moment they get a COVID positive report, they start searching for remdesivir, when even though it is not required. In most of the cases, this drug is not required, but still they want to self-medicate, and that is what causes the maximum damage. Because then they want to hoard it, they want to self-medicate, and it makes a course much, much worse. So I feel you have to stay away from the infodemic. The pandemic will take care of itself. Like most storms, it will pass. But if you are just going to make it worse by, second guessing everything, by not even trusting your doctors. I get so many phone calls when people they call me up and they say the patient is having an oxygen saturation of 80. And I'm like, what were you doing for such a long time? No, we were just on WhatsApp, we were asking 100 questions. But you were not actually monitoring in a logical, in a structured way. You were not just simply looking at the temperature and the oxygen saturation. You were on the phone. You were watching the news. And I do feel there is a need for all of us to calm down and to understand this rather than just panicking and, predicting doom for the rest of us.
No, in fact, I
Yes,
think if you're a primary or a secondary caregiver, for your own mental health, it's best to stay away from news that you
right.
don't absolutely need at this time. Otherwise, it can just drive you absolutely crazy and into a panic, sort of mental state all the time. So, Bhavna, sorry, you wanted to say something? Bhavna, do you want to come in?
Yes, thank you. So, Shalini, I'm a big fan of Viktor Frankl, who wrote Man's Search of Meaning. And one of the quotes in that is, we all have choice, and I'm paraphrasing right now, which is that between the stimulus and our response is a pause. So, yes, the news is a lot of stimulus and it triggers feelings of anxiety, fear, and helplessness, guilt, perhaps. I'm so long distance. What did I do? Why am I not close by? Why am I not at the thick of things? To pause and then take a mindful response. So, I am where I am and I can do what I can do. So, what is the best that I can do from where I am is something that secondary caregivers can do. For example, if there is mind numbing news and it has impacted you, make a choice whether you want to forward it, you want to get affected by it, or you want to go out for a walk in the sun to let it go from your system.
You're teasing us people in lockdown, Bhavna. Walk in the sun.
Well,
No, go
that
ahead.
was
I was just, I'm sure you had no
not literal,
idea.
not literally. I meant you could have a long shower. There are so many other
Do
things that you
something
can do.
self-soothing. Yeah, absolutely. I get the point. Sanjay Thakur, there are advertisements about bionic sanitizer. Are these useful or sales pitch as people are rushing to buy all such products with slightest nudge from any source and feel worried? I don't know if anyone here would know anything. Do you know
I think
anything?
I think soap and water is good enough. If we don't have soap and water, then a normal sanitizer with decent alcohol is good enough. You don't need anything more than that.
Yeah, yeah. Um, Thanks, Ajay. Ajay says highly informative and relevant. Thank you. Nirmala says it's a tough challenge to convince chronic patients about COVID norms. At times, their happiness or comfort is more important than their safety. Is this the right attitude for a primary caregiver? It's a tough one. I think, Sujata, I don't know if you're the one who's better equipped to ask. So, if you're a chronic patient of something, I guess, maintaining COVID norms, do you have a perspective?
I think the right counseling, as I said, that even if it's a chronic patient and he or she gets COVID-19, then of course there's a lot of panic and they are used to a certain kind of care, which suddenly they are deprived of because all of a sudden isolation is the norm and it's very difficult for them to actually come to terms with this. But I suppose processing of information, counseling is what works right now.
Thank you. Thank you for that. So, Sujata, one last question from me actually to you. I know that you also have a YouTube channel and you have been sharing information that will be helpful about the COVID pandemic itself. So, if you want to share, how do people watch your YouTube channel? What's the name of that? And if you could also share your own predictions about, how this pandemic is going to play out.
Okay, my YouTube channel is connected with my Gmail. So it's Jata Sharma 1806 1806. That's also my date of birth. And it's like this that last year I had written a book, Warriors in White, in which I had written about my own predictions because I've been working on viruses and bacteria for the last almost 25 years. And coronaviruses are very, very tricky. They are absolutely, should I say, they are con men, they're the con men of viruses. They come back with disguises, they come back with new tricks. And when I say new tricks, I mean that they, like you might have heard, mutants or variants. They come back and they hit you again and again. Sometimes there are many people, sometimes there's two or three or four. So when this virus had come, I had known that we are going in for a long haul. This is not something that, and I've written that in my book also, that let's expect some time, because this is going to keep coming back with new tricks and we have to prepare ourselves in that way. So I feel it depends on us, Shalini, how we go about it. Vaccine is the answer, yes. So everybody needs to get vaccinated, because I have seen that in the countries where the vaccination drive is very high, they're going out maskless now. For example, Israel, if you see, they have vaccinated something like 58% of the population and they don't even need masks anymore. So vaccination is a must. And of course, we have to avoid social gatherings as much as possible. Because I always tell people that this virus is basically like fire. And if you are gathering together, then you are giving it fuel. You're fueling this. So you have to understand your responsibility. And most likely, if we are all going to get vaccinated soon, and as soon as that turn comes, and of course, if the vaccines are there in good numbers, and also if we are going to be responsible in our behavior, most likely we'll see the end of it by the end of this year or next year.
Right, right. So what you're saying is this may not be the last wave. We might see more waves after this as well, because coronavirus has this property of coming back in a new form. That's just how it is. And therefore, vaccination and persistent social distancing for a while, quite a while perhaps, is the only way out of this problem.
True.
Great, wonderful. Any last words, Bhavna? Any last suggestions for caregivers?
I'd like to build on that point around social distancing. The point I'd like to make is physical distancing is what is essential. So let's get the physical distancing in place. We need social connections. We need to feel two things. One, that somebody is holding our hand through our difficult times. So if there are virtual gatherings, for example, in Caregiver Sathi, we conduct support group meetings regularly. And we are also now conducting sessions on love and loss, so that people can cope with those, with the fact that we are all grieving in many ways. So finding ways in which we socially connect, even if it is virtually, is absolutely essential. Grief, whether or not it is about the loss of a person, is something that we individually go through. However, can be worked through only with other people. So we need other people to work through our sense of grief and loss right now. You're welcome to see the details that we publish on our social media or on our website. The second thing is we are running a very extensive volunteer program with people from all over the world volunteering for authenticating information for family caregivers. So the access to medical facilities and any other services, there is a volunteer program that you can have access to should you want to contribute.
That sounds wonderful. So I think we're at the end of the hour. I must say we have two amazing women today, and both of whom you can follow individually. Sujata has, besides being an author, she has her own YouTube channel now, which makes her, ideas all the more accessible. Bhavna's website, her, groups, support groups, information, articles, etc., are also worth following. So thank you both so much. Thank you for all this helpful information. I think I love the combination of, what does it take to stay physically safe, along with what does it take to be emotionally and mentally resilient to what's going to be, as you said, Sujata, a pretty long run. And I think that's all going to be helpful information for all of us. I'm also hoping that this will help all of us who will be either well-wishers, secondary caregivers, or even sometimes primary caregivers, maybe multiple times through this long run of COVID, will have a better idea of what to do to support the primary caregiver. So with that, we come to an end of our conversation today. Thank you both so much. And for all of you who are watching us, follow us on Uncube, visit our website. We've got 32 other conversations. I'm sure you'll enjoy many of them. Thank
Thank
you.
you so much, Shalini. I really appreciate your setting this up. Lovely to get to know Sujata as well, and we'll get
Thank
through
you.
this.